mamas and mamas to be. This is the podcast that is going to take you into the Hen House. We are talking all things intuitive and mindful living and mothering, as well as preventing birth trauma and healing from birth trauma. We are bringing you real talk, real connection, real community, and hopefully some real inspiration as well.
We are your hosts, Andrea
and Chantal.
And if you're ready, it's time to jump into the Hen House. Hello, welcome back everyone. Welcome back. We're so glad you're here. Super excited. We have a wonderful guest today. This is Alex Hoeft, and she is a former labor and delivery nurse. And she is a doula currently, and she is really excitingly a doula trainer as well. So she has a really wonderful course also to train doulas as well, bringing in a lot of her knowledge. And I believe she also does childbirth education and is just a phenomenal human and a wonderful mother and such a source of information. And so we're super excited to have you.
Hey, Alex. It's wonderful.
Thank you so much for having me. Sorry, my little ones are here and they're trying to infiltrate. So we'll make the best of it, especially the 2 and 4-year-old. They just really, and she colored all of her hands. So she just waved and showed you her yellow. But thank you so much for having me. I'm excited to be here.
So before we jump into some of the questions that we have for you, I would love if you want to take a minute or two and just tell us about your experience. I guess that could probably take more than a minute or two, but give us a little blurb about your time in the field versus, joining the newer field of being a doula.
Yeah, so I went into labor and delivery right out of nursing school, and I had just had my second baby at the time. So I had 2, and right into labor and delivery. That was always the plan. And when I first started, I was very, very medically minded. Basically, like everything that, I'm sorry, she just turned off my computer. Okay, we're good. It's still here. Perfect. Basically like whatever the doctor said went, right? Especially being a new nurse and then the older nurses. And okay. So anyways, I felt like when I first started, it was basically like whatever the doctor said went, and, very, very medically minded, very into like, just, the evidence and the research and like science and not really questioning anything, and did that for about 3 years. I was interested at the time, though, in natural childbirth and learning about natural childbirth, but in the hospital setting, it's very, very, very challenging. Even though they say that they allow that, or, that you can birth any way you want, it's very hard. I don't think I saw more than maybe 2 or 3 births without an epidural in the entire time I was there. And I think that is changing now. I haven't been back as a nurse since, would have been like 2018 that I left nursing. And then went into, had my 3rd baby, and then just decided not to go back and kind of looked into more of the natural side of things, and things just kind of changed. And I got more involved with local chiropractors and lactation consultants. I told you today is really rough. They are making it very challenging today. I do not know. Like, my gosh. Okay, I don't even know where I left off. So
it's okay. You said all the things that gave me good direction for where to pluck our first question from in our list of questions. So you mentioned that, people say, oh, you can give birth any way you want in a hospital. There's lots of things we've heard regarding that. And so something we see on social media a lot, there's lots of sound bites about this, about you can fire anyone on your team at any time, or you can deny any intervention. What's the reality of that? Let's say I fired someone today, or let's say I had a hard no against something. Do I really get to make that choice, or are there consequences for my choice?
It's a really deep question. It's really loaded because it's yes and no. And it depends on where you're located, who your providers are, where you're giving birth, the specific doctors in the area. I can say that most of the doctors want to let you birth in the way that you want to. And a lot of women can have a really beautiful experience in the hospital setting. But I have seen it is a lot more challenging. But then at the same time, women who want to birth in the hospital setting, the majority of those women are interested in medical intervention or an epidural or pain relief. So it's kind of, it's hard because again, if you want those things and you're open to those things, then you're not going to have a fight. But if you don't want those things, it can be more challenging. And I can say, the whole, yes, you can fire your provider. I will say from experience, there is one of my doula students had a doula client who had a lot of challenges in her pregnancy. And the doctor was telling her, she had to do this, she had to do this, she had to do this. And then I said, just get a different provider. And the provider said, no, I'm sorry, we're not able to do that. So you'd have to basically relinquish your care, start elsewhere, like go to a completely different area. And they wouldn't let her do that. So I think it really depends on where you're giving birth and what your specific circumstances are. For example, if you're someone who has a pre-existing condition, like a heart condition or diabetes, or you end up developing hypertension or gestational diabetes or cholestasis in pregnancy, or you have a baby who has, is not growing properly or has placental issues or something, it'll be more challenging to find a provider who's going to take you. And also the area that we live, we kind of call it the birth desert, me and my doulas and doula students, because we don't have a lot of options for providers here. Not really. There are 3 local hospitals in our area. They're all the same through the Aspirus network. But for example, me being now almost 29 weeks pregnant, I couldn't get in to do my 20-week anatomy scan. There was just no openings. And so I said, could I just go to one of the other local hospitals that are within 20 miles of where I live? And they said, no, you'd have to discharge from care, reapply for care with a different hospital, even though it's the same network, right? And then you'd have to wait to get in. So I think a big thing is it depends on where you are and what your options are. It really does. And every doctor is going to be different. So that's why I know that was a long-winded one, but the answer I think boils down to it depends. It depends on who the providers are, what your options are, and how those providers view birth. Because I have found in nursing, the majority of doctors want to help you. They want to do what's right for you, but they do, a lot of them, especially the older providers, are based on fear and just not really understanding how birth works outside of using any kind of intervention.
Right.
They just don't understand it. And it's not that, again, they're trying to harm you. It's more so that they just don't understand it because that's not what they were taught. Just like when I started out as a nurse, I didn't understand that. And it's just not what I was taught. So it was harder.
Yeah.
Does that make sense?
It does. And you talk about it depends who your providers are.
Yeah.
I would imagine that the way that the system is designed, your OB/GYN, and maybe there's more than one assigned to each mom, but I imagine they're kind of the head of or the top of the totem pole, if you will, for a woman who comes in with a midwife or with a doula within the system. So now they have additional care providers or team members. Is that realistic? Is that effective? How does that go?
That's, again, it depends too. It depends on where you're birthing. So for me, for example, this is our 6th baby and we're having our first home birth. But because of insurance, it makes more sense for me to do all of the blood work and all of the testing and anything medically based through the hospital setting. And so my primary provider for this pregnancy is a midwife, a home birth midwife, so certified professional midwife or CPM. But I am also seeing an OB, except I'm taking everything that the OB says with a grain of salt. And my midwives also suggested if I'm comfortable not telling the OB that I plan to have a home birth. Because in our area, if they know that you're going to have a home birth, they will basically write you off and they won't see you. So it depends on where you are. It depends on, are you talking about, you want to see an OB and you also want to just be following up with a midwife? Or are you talking, that you want to birth at the hospital with a midwife? And in that case, you would have to use a certified nurse midwife, because the certified professional midwives, at least in Wisconsin, I don't know if their license permits them to deliver babies in the hospital setting. So they're only doing, at least the ones that I know in our area, they don't have rights at the hospital. So if you're seeing one of them, you're going to be having a home birth or a birth center birth outside of the hospital system. But if you're seeing a certified nurse midwife, like we do have one here who's in a little bit north of where we live, and she will see patients and only deliver in the hospital. But then because she works in the hospital, even though she's a midwife, she basically practices like an OB. So we have a lot of women who go to see her and think, oh, I'm going to have midwifery care. This is going to be great. I'm going to see a midwife, but she practices just like the OBs practice. So it really depends, again, on where you're birthing, what your plans are, what your risks are. If you're a low risk birth, I mean, you can see any provider, but you do have to be careful. Again, like me, for example, if I were to tell the OBs like, hey, actually we're planning a home birth, they would write us off. And then we probably, go with your sister, please, wouldn't be able to see them anymore. And they would essentially say, oh, you can't come here anymore for your prenatal care. There you go. Take that with you.
You're doing such a great job of segueing your answers to one question, segueing into answering other questions. Because I know another one talking about, I've noticed it here where I am.
Yeah.
It's almost like I'm sure it's not just like a colloquial term for, there are a lot of midwives now who are more midwives. And they don't really practice traditional midwifery. They seem to push for more intervention. They seem to do a lot of dictating. So taking that power away from a woman in the most powerful time of her life. And I was going to ask, but I was curious about your thoughts on, as we call them, the midwives, and where that shift has gone. I know we have kind of seen it with the regulation of midwives, and when they kind of became a licensed professional, that it seems that's maybe when the shift has taken place. So I'm curious your perspective on that.
Yeah, again, it's so hard because I think it's really specific to where you're practicing and who you're practicing with and who you're practicing under, and also like what you're comfortable with. And if you are a licensed midwife, you do have to follow rules, regulations, standards. Like there are specific things, but I have learned from some of our local midwives. So we have, where I live, there's like 4 different groups of midwives, but for some of them you'd have to travel. And one of them, she practices independently. And she said there are workarounds for a lot of the, for example, if you have someone who is a VBAC, because I do have some local midwives who will not take VBAC patients for home birth. But then this one who practices a little bit further north, she will, because she said there are workarounds. So it kind of depends on the midwife. And it depends on, again, are they practicing in the hospital or are they practicing at home? In a home birth setting, are they practicing independently? Are they practicing in a birth center? Where do they do their training? And I wish that it was like an easy, if you go, if you choose like a professional midwife versus a certified nurse midwife, you're not going to be dealing with, the medical stuff. But again, I cannot untie that right now. You're going to have so it really depends though. Emma, it is hard. It is hard for them. They don't like when mommy's on the phone. And I tried to get my mom to come today, but of course she's busy. So I'm like, well, we are basically like throwing us to the wolves right now. It depends on who you're seeing, where they are, what training they've had, and what they're comfortable. So like, yes, there are midwives who practice as midwives. And I'd say that that's more the certified nurse midwives who practice in a hospital setting traditionally, but there can be home birth midwives who are more medically minded. you really have to do your research and ask around and say, you know, have you worked with this provider before? What do you think? You know, do you have experience with them? How do they practice? You can also ask them questions. For example, let's say I were to go past 41 weeks and we're getting closer to 42 weeks. Are you going to transfer me to the hospital, or are you going to let me stillbirth naturally at home? Or if I have a GBS positive test, are you going to recommend strongly that I do antibiotics, or are you going to be okay if I decline that? Or I want to decline the gestational diabetes test because I've had 5 other pregnancies without gestational diabetes. Is that something where you will then drop me from care? So you have to kind of know what questions to ask to find out. And the unfortunate thing is that, I don't know how to put this lightly, some people might lie, or maybe, I don't know if they're necessarily lying, but they might say one thing and then do something different when it comes to it. I know there are providers who will tell you one thing and then when it comes down to it, do something different. And that's why I say lying very gently, because I don't know if they're, again, intentionally trying to fib information. But I have seen a provider say, oh yeah, this is totally fine, you can do this. For example, there was one in the area who's like, yeah, I would definitely deliver a breech baby at the hospital. And then one of my doula clients found out her baby was breech, and I called him and he wouldn't even see her. He said, nope, that's just a C-section. So it's hard. It's very hard. Again, I do think most providers are trying to do right in their patients' eyes, but a lot of them are focused on fear and about losing their license, or, you know, getting a bad name with their career or a lawsuit. So I think as a woman, you have to be willing to do the work. You have to be willing to ask around, get some opinions, interview providers, and then be willing to take that on. And a lot of women just aren't, and that's okay. There's nothing wrong with that. But you have to understand then that they might say one thing and do something different. And again, it might not be intentional. It might just be the way they practice.
Right. So for a more naturally minded mom who either ends up in a transfer to the hospital that they weren't anticipating, or who, for whatever reason, says, you know what, I think it's my best option to birth at the hospital, what would you recommend for them to get kind of the best outcome for themselves when maybe they are wanting to deny certain interventions, and they may push back and they may ask questions? And how do you navigate that? Because it's more it's easier to birth in the hospital if you're like, oh, just do everything, I'm happy with that.
Yeah, that's really tough. And I can say with my 5th baby, I have that example where after the birth of our 4th baby, for a little backstory, my first 4 births were all hospital births with an epidural and Pitocin at some point. None of them were inductions, but they all just ended up going that way and then ending up with a epidural. And after the birth of my 4th baby, having an epidural for 48 hours, I said, never again. And then dove back into my research in all things natural and how, figuring out ways to make it work. And then with her, if you know you want to birth in the hospital and you want a natural birth, you stay home as long as possible. That is my one biggest piece of advice, because if you are home, they can't force you to do anything you don't want to do. You can eat, you can drink, you can go in the bathtub, you can go on a walk, you can wear whatever you want. You're not on the monitor. But that's hard if you live, more than an hour away from the hospital, for example, or you also don't want to get caught driving during transition, because that's not very fun either. So you kind of have to play it carefully. And that's when I would recommend definitely having a doula, because they can kind of see from their experience, do you need to go into the hospital yet? Or is this most likely early labor? And it can be hard to tell with some women. I have had some clients who I thought they were a lot further along than they were based on, their vocalizations, their facial expressions, how they had to breathe through contractions. And we ended up going in too early with one client, and then one we made it just in time. So having someone there who's experienced and can help you and kind of guide you to when to go to the hospital, that's the biggest thing. But then going back to my 5th birth with her, I stayed home And she was born within 20 minutes of me getting to the hospital. So they didn't have time to do anything. They didn't have time to put me on the monitor or start an IV or draw blood or do anything. So if you can wait until right before you're delivering, then you still can have that natural birth in the hospital. But in the same breath, I do also have some doula clients who did birth in the hospital, one that did have to be induced for a very good reason. And we talked about all of the, risks and benefits, but her baby ended up having a very rare kidney disorder and all of her amniotic fluid was gone. I mean, we're talking all of it. And I'd never experienced that before as a nurse or as a doula. And so she had to be induced at 35 weeks, but we had prepared so much and she knew everything she wanted and what she didn't want it. And she was able to be in control. And she did have a great induction. She never got an epidural. She didn't get any medication. They went to try and break her water at that point and nothing came out because he had truly consumed all the amniotic fluid because of his kidney issue. So I know that's kind of like an unrelated topic, but it just shows that even if you do have an induction in the hospital setting, it is still possible to have the birth you want, but you have to be willing to fight for it. In most cases, not always, but I think the biggest thing is being willing to take on that responsibility. And again, birth is so hard because I do know a lot of women who had beautiful medicated births and love that. And that's what they wanted. And then I also know women who didn't want that, who were forced into it, or women who wanted it and still had it. And it was a fight. So my biggest piece of advice, if you want a natural birth in the hospital, is be willing to take on the responsibility yourself, stay home as long as possible, and then be okay to fight if you need to, and, stand up for yourself, and then also have a doula or a support person with you who is willing to fight when you can't. Because at some points in labor, you get to that point where it's like, nothing is going to work. Please stop that. Nothing is going to help. And you just can't really talk anymore. And at that point, that's when doctors might say like, oh, you have to do this, or you have to do that. And you're so vulnerable during birth that you're more willing to give in when you maybe didn't want to before. Can you grab my computer charger?
That leads me to kind of two thoughts. And one is you had made a post kind of talking about inductions a while back. And you had said that often it will say in the file, patient requested the induction.
Yep.
Does that happen often? And does that happen with other interventions as well, where kind of maybe women get badgered and then it's like, oh, the woman requested this?
Yeah, unfortunately it does. And again, like so much stuff in birth, it's like, it's so hard to like say, or do, I found that I'm like in the camp of, I lean more towards natural, but I also like know the medical stuff too. And so I can see sometimes why we do things, or like I respect decisions of women who do choose, for example, to birth with interventions. But I can say as a nurse, when I did work in the hospital setting, I would go in and say, okay, why are you here? What are you here for? And women would say, oh, I'm being induced because my doctor said I needed to be. And then I look at their chart and that's where it contradicts it. And it says maternal request induction, meaning the patient requested it, even though the doctor might have said, oh, you need this 39-week induction, or your baby's big or something. Did see a lot of that. And I do think that doctors, now we're all happy, maybe for 5 minutes, possibly. But I did see it a lot, especially with interventions too, where the doctor will say, I obtained consent. And I don't know if they necessarily did. Like, did you maybe had the patient like nod their head yes, or say sure, but did you actually obtain consent where you said like, here are your risks, here are your benefits, not, okay, I'm going to do this now. And then they chart that as obtaining consent. Because I've seen that before, that, oh, I'm just going to break your water, or I'm just going to do a internal lead for monitoring the baby's heart rate, or I'm just going to do this. And then they document that as I obtained consent. So it really, yeah. So it depends again on where you're birthing and who you're birthing with. And there is a lot of that like charting inaccuracies, where they say like, I obtained consent when maybe they didn't, or the woman thinks that she needs to do something and she didn't really need to. It's very hard. It's hard to know. And in most healthy cases, in healthy pregnancies, in healthy births, we don't need to intervene.
Alex, I'm really curious. Here's your pen. Here you go. I'm really curious about your opinion on when interventions begin. And I'm going to kind of backtrack that a little bit with, I think a lot of people consider it still natural as long as they didn't have an epidural, or some even don't consider that as not natural. They'll think only if it was a C-section, or only if I had forceps or vacuum used. And I have my own thoughts on when interventions begin and when the cascade of interventions begin, but before I maybe go there, I'm curious for you, what is the beginning of interventions? Where does that start?
Okay, just don't spill it. Mama's going to move it over here. I think first and foremost that all birth is natural, regardless of the way that we do it, but there is a difference between natural and unmedicated. And I think that's kind of what you're saying. So birth in and of itself is natural. It was something that women are designed to do. And any way that you give birth, whether it's medically, whether it's with a C-section, whether it's vaginally, whether it's with forceps or a vacuum or medication, it's still natural. But in the natural community, people will say, oh, it's not natural unless you did it medication free, or please stop kicking my computer. That's not helpful. So I think that there is a difference between an unmedicated birth and a medicated birth. And that's where I would say like the interventions start. And there is a thing that we say in like the home birth community, that the second you put on that hospital gown, or the second you set your foot out the door to head to the hospital, that's when the interventions start. And I do think that that is true, because any intervention in birth is anything that is not something that would normally have been done. So if you are leaving your house, that's when intervention starts. And people who are more unmedically minded, in a sense, because you're disrupting the normal birth process the second you leave your house, the second you do something outside of what your body wants you to do. Right. So they'll say, no, honey. The second you leave your house, I think, is when that intervention starts. But then if we're talking about like medical intervention, that would be... Oh, consequences. Okay. If we're talking about medical intervention, that would be more so, okay, baby's on the monitor, mom's getting her blood pressure checked, she's got an IV, we're in the hospital setting now. You need to go away, please, Lorelai, thank you. So I think there's a fine line between talking about like birth that's natural, I think is all birth. Birth that's unmedicated then would be a birth that doesn't have any kind of interventions. So we're talking like a home birth or free birth, which I don't really know a lot about free birth, or a birth, again, in the hospital where you're declining an IV, you're declining fetal heart rate monitoring, you're declining cervical checks, you're declining...
I'm so glad you mentioned cervical checks. Yes. I was hoping you might go there, because I feel like a lot of people don't consider that even something as routine, if you will, as a cervical check is, I think the word to use is going against what would occur on its own.
I think cervical checks are the most invasive and useless piece of information that you can have in labor, to be honest, whether it is a medical birth or a non-medical birth. Like, they are just completely useless. They're invasive, they are painful, they're uncomfortable, and they really don't give us accurate information. For example, my last baby, they required me to do a cervical check, and when I got to the hospital, they say, oh, we won't admit you, you have to do a cervical check. Emmeline June, stop. It's the 4-year-old and the 2-year-old, you guys. That's what's going on. But they are like, oh, we required your cervical check. So I get in, they did a check. They said I was 7 centimeters, and then my baby was born within 20 minutes. So you can go from being not dilated at all to having your baby in under an hour. or you can be at 10 centimeters for like 5 or 6 hours and not have your baby. So when we're checking the cervix, yes, in a medicalized birth, if you're on Pitocin, it does show if you're dilating, you're going from 1 or 2 centimeters now to 3 or 4, that labor is progressing, but I feel like it doesn't really give us good information. It really doesn't. There's no need to do it. And the midwives that are delivering our 6th baby at home, they said, you can decline those. And you can in the hospital too. You can decline it, but they will probably fight you on it. So I think they are probably the most useless and invasive piece of information in birth, honestly.
Your answer was so perfect.
Thanks.
Everything I've learned, and I only have one, for whatever that's worth. But my experience is the time it takes to get from 1 to 4 is not representative of the time it will then take to get from 4 to 10 or from 10 to birth. And so it just, for me personally, makes no sense. And I think it can really disrupt the mental game of a birthing mom, because you think, wow, I've been doing this for a long time. It's really painful. I must be close. And if someone were to tell you at that point that you're only 4,
yeah,
man, that would be crushing.
Yep.
But without telling you that, like, hey, it might only be 20 minutes and you're done.
Yeah.
So
and that's tough. Like, that's what I talk about with my doula clients. We do a lot of that conversation about the mental game of it, like, is getting a cervical check going to make you feel empowered? Knowing like, oh, I'm 4 centimeters or I'm 6 centimeters, is that going to make you feel good? Or is that going to discourage you? And if you feel like it's going to discourage you, then I advise against it. And you can also change your mind later on in labor and you decide, actually, yeah, I kind of want to know where I'm at. And sometimes then that can encourage you to get through the last little hump. So they can be useful sometimes for some women, especially those like me in my first birth, type A, really wanting to know everything. I felt like it did encourage me, but originally discouraged me when I went in after 24 hours of laboring at home and was only 4 centimeters and had been 4 centimeters at the clinic the day before. And that like originally discouraged me, but then later on, after they had given me Pitocin, and then I, was going through the whole thing and had an epidural, and then all of a sudden I was 10 and the baby was like coming out, then I was encouraged. So again, that's one of those things that's really challenging, where sometimes it can encourage women, but oftentimes it is a mind game. Oh, you're only 4 or you're only 6, or wow, you're already 10, you should start pushing right away. And then you push for 3 hours because you actually weren't ready to deliver.
Yeah.
You just were fully dilated, but your baby was still high up in your pelvis.
Yeah. You weren't having a fetal ejection reflex at that point, but you're pushing against what's physiologically normal.
You're 10 centimeters, so it's time to push.
Now, my case was kind of different because I actually ended up asking for a cervical check finally, because I was like, I need to push. And they're like, you're in early labor. And I'm like, no, I need to push. Like, I'm starting to push on my own already. And like, I am there. And they're like, no, you're in early labor. Like, you're talking to me. And I was like, people, I did meditation to prepare for this. Like, the pain is not an issue. I'm ready to push. And so finally I was like, can you please just like do a cervical check and stop telling me I'm in early labor? And then they're like, oh my goodness, she's already at like 2+ station.
Yep. And that's hard too, because then they're so dismissive of women too, where it's like, you feel something and they're like, no, you can't be that. That's not possible. And that is really frustrating, because it's telling you that you don't know your own body.
It's disconnecting you from your own intuition, from yourself, from your power, like all of it.
No, you can't be that far dilated because we just checked you. There's no way. And that's
they hadn't checked me yet,
but still they didn't.
I had declined it up till then, but they didn't believe me. And I was like, whoa, like I feel like I have to poop. And they're like, well, then go poop.
And then it's very
and I'm
dismissive.
like, yeah, no, it's not that. I know it's not that.
And that it's frustrating, because that takes away that autonomy that they say you have, right? That you get to make the decisions. And it's like, I'm telling you one thing and you're telling me, no, I'm wrong.
Right. I personally feel like, how dare you ever tell a woman who is expressing what she's feeling in her own body that she is not feeling that she is wrong.
Like
How
any
dare
person,
you?
right? Anybody, like male, female, child, adult, like saying that, no, you're not experiencing that. How do you know? How
Right.
do you know I'm not experiencing that? Are you in my body? I sure hope not, because that would be really strange.
Yes.
Like, I don't think maybe they have that technology now, but in 99.9% of cases, I don't think that's the case. And for someone to tell you, no, you're not feeling that, or no, that's not true.
Or not possible.
Yeah. And that's really frustrating. That's really frustrating. What are you eating?
So regarding interventions, what do you feel like women should know going into it?
Oh, goodness.
Like,
I think that's a really tough. I think that in the majority of cases, interventions are not necessary and usually cause more issue. And then, of course, the whole cascade of interventions where it's like we do one thing, and then because we did that, like we broke your water. So because we broke your water, now baby's in distress. So we need to add an IV. And now, okay, you're not dilating. So now we have to do Pitocin. And now you can't handle the contractions because contractions with Pitocin are typically a lot worse because they're not normal. It's not like a natural thing, this synthetic form of oxytocin. So now you're getting the epidural, and it just keeps going and going and going. And that's not the case with all deliveries. It's not. But I can say that it's more common that if you do one thing, whether it's getting an IV or doing continuous monitoring or having your water broken or getting an epidural or taking pain medication, usually in most cases, if you do one thing, you're going to need to do something else. And that does not always mean that it's going to end in a C-section, but the chances increase exponentially if you do one thing that you're going to have the birth that you didn't want, where now we're needing more interventions and more interventions and more interventions, and then it's ending either in birth trauma or a C-section. And I do feel like that happens a lot more than is talked about. Any intervention, whatever it may be, again, whether it's leaving your house to go to the hospital or getting an IV or doing monitoring or taking pain medication, like there's risk in everything. There's risk in just walking out your door in the morning when you're not pregnant, right? Like getting in the car and driving to work. There's risk in everything, and you need to be willing to decide what level of risk you're comfortable with, what level of intervention you're comfortable with. If you get one intervention, are you comfortable that things might change and you might end up with a birth that you didn't want? And that's what you have to look at, is your comfort level and what you're okay with accepting. And again, most women who are going to birth in the hospital setting and know that they want an epidural, they're okay if things go differently. Most, not all. But I can say a lot of times you get to that point in labor where you're just ready to be done and you're like, do whatever needs to be done. And so it is hard. And again, one intervention is not a guarantee that you're going to need more. But it's pretty common that if you get one, you will likely get another and maybe another and possibly end up with a birth you didn't want. It's more likely. The more interventions you get, the more you're likely to need and the more chances of birth trauma or ending up with a birth you didn't want. It's really hard. And I wish, I used to have a doctor who said, I wish I had a crystal ball that it could tell me like exactly how your birth is going to go so that you can make the choices that you need to make, because we just don't know. We don't know. You could be someone who did all the things. You took all the supplements you were supposed to take. You took all the classes. You had massage therapy. You went to see a chiropractor. You exercised, and then you still end up with a C-section, or you still end up with birth trauma. So like you could be the one who does all the right things and still have a birth you didn't want, or you could be someone who did absolutely nothing, didn't prepare at all, and goes and births at the hospital, didn't have time for an epidural, and your baby comes in like 15 minutes. So there's just like, there's no for sure in birth. There is no guarantee that if you do one thing, this will happen, or if you don't do one thing, this will happen. And that's what's so hard, because we can't give any guarantees ever. We can't say, yes, for sure, if you take this class, or if you do this exercise, or if you meditate, or if you see this provider, there's no guarantee. And the only guarantee is that your baby will be born in some way or another. That is the only guarantee. Your baby has to come out. It's the only thing I can guarantee my clients is, yes, your baby will 100% be born. we just can't guarantee the way that we do it. And that's what's so hard with birth, right? Like it's not a standard, you do this, this is your end result. You know, like you prepare for a race, you work really hard, the chances are you're going to do well. And that is the case with birth most times, but it's still not a guarantee. Go ahead and have some. Yep. So again, I know that was like a long-winded answer, but it's so sure. It's just so hard to know. It's so hard to say, like, again, if you do this or don't do this, this is going to happen. And I can say that all of my births were very different, and they all, you know, did similar things for them, and they still went a different route. So it's just every person, every birth is different, and there's no guarantees. And interventions do make chances though for birth to even one.
So Alex, you've kind of touched a few different times on as the progression of labor goes, that mom can get, oh, excuse me, please take that dice out of your mouth. That mom can get to a point where she is more likely to just say, yeah, and go with it. So how important would you say it is to ensure that there's someone else there who knows what mom wants and ultimately doesn't want, and will advocate for her when she's maybe not able to speak for her?
Don't just take the chocolate out. I think it's very, very important. I think it's necessary. I think every single woman, regardless of whether they are married, single, dating, they should have somebody with them who knows what they want and has some kind of code word or code color or something in place for if things are going, you know, and they can't answer, right? So would say, like with my clients, you know, do you have a color? And that's something they do in hypnobirthing too. It's like, do you have, like, things are going and they're, you know, things are changing, and you have like a code word or something, like you say purple or blue, and then they just know that like they need to take over and answer for you. Because oftentimes in labor, we do get to that point where we can't talk anymore, or we're not comfortable talking, or we say, you know, oh, I can't do this anymore, I'm just going to give up, like, give me the medication. But it's like, do you actually want that? Or are you just at that point in labor where now you're transitioning or you're exhausted and you're just saying that? Because you'll say things in labor sometimes that you don't mean. And so having that person with you, whether it is a spouse or a mother or, you know, a best friend, a sister, a doula, somebody who knows your wishes and your wants and knows when you are being serious and not just saying like, oh, I can't do this anymore, I want an epidural, but really you don't actually want one. You're just like saying that because it feels good to kind of say things, you know, to get them out. So having that advocate for you that you meet with ahead of time, ideally at least go by your sister, at least 2 times before birth. So you can determine, you know, these are my wishes, these are my wants, these are my absolutes. Like this is an absolute no, or this is an absolute yes. And to have that advocate, I think it's a huge necessity for birth, because if you don't feel supported, if you feel like you're alone, then it makes birth, it makes it a lot more challenging, because birth is very mental, it's very emotional, it's very personal and intimate. And if you don't have someone there supporting you, I think it's just, it can be catastrophic. I really think it's important, regardless of who it is, but someone that you feel 100% comfortable with making those choices for you if you can't anymore.
Yeah. So kind of along those lines, what would you recommend for women regarding like a birth plan or the benefits of preparing, even though it doesn't guarantee? Kind of what would you say on that?
I think it's so important too, because women need to take on that responsibility, right? I think they need to learn and really understand how birth progresses, the normal, natural, physiological process, even if they want to get an epidural, right? They still need to learn, this is what happens to your body. This is what your body goes through during labor. This is what happens after birth, that you have to birth the placenta, that you will have, these are your options. I think it's super important, whether you take a class or you do independent research, that you understand how birth works. I think that's even more important than having a birth plan, because I do think a birth plan can change, but in that same breath, having on a birth plan your absolutes, like I will absolutely not accept this, or I know that this is what I want. I think that's more important than saying like, filling out the cute little birth plan that the hospital gives you that sadly most of the nurses don't even look at anyways or pay attention to. I can say that from experience. Please stop shaking that. So I don't think that's necessarily as important, like writing out everything, unless you're somebody who processes things in a written sense. If you're somebody who needs to process everything externally and write it all down, then it can be really helpful for you. But otherwise, I think the biggest thing with that birth plan is understanding how birth works, knowing what to expect, and knowing the risks and benefits of all the not all the possibilities, right? Because there are so many things that can happen in birth that we can't control, but the common things, right? Like, are you okay with an IV? Are you okay with cervical checks? Are you okay with fetal monitoring? During pregnancy, are you okay having, blood pressure checks? Are you okay doing the GBS swab towards the end of pregnancy? Are you okay with a gestational diabetes test? Do you want routine blood work? And knowing those things and really educating yourself. I think that's more important than an actual birth plan per se, because that essentially is a birth plan in and of itself, right? Like educating yourself on what to expect, how birth progresses, and what your options are, and then having someone with you who knows what you want. I think is like, it's more important than those cutesy little like written out birth plans that, again, the hospital gives you, or that you can get on Etsy, or some women do benefit from that though. So, and that's okay. There's nothing wrong with that, but I don't think that's a be all end all. I think not understanding how birth works is really detrimental to the birthing process, more so than a specific plan. Does that make sense?
Yes.
Yes. What I'm hearing is radical responsibility.
Yep.
Understanding how things work, because then you can make educated choices.
Yes.
And like you said, it's not about whether you do this or don't do this, but understanding this is what the physiological process is, and this is how this choice can affect or change that, and what other choices may come from that.
Absolutely. And are you okay with what could happen if you make that choice? Is that something that you're comfortable with? For example, are you okay with getting an epidural and potentially having it slow down your labor or speed up your labor, or potentially having it cause fetal distress and getting a C-section? Or in the same breath, if you get an epidural, maybe it makes your birth more relaxing for you and you're someone with anxiety and it actually helps you. So you have to be willing as a woman to know what you want and to understand your options and to take responsibility. And that's what's hard, I think, for a lot of people.
Yeah. Well, and I feel like when you do your research ahead of time and really sit with yourself, you get the chance to figure out what you want.
Yes.
And figure out what the options are, because I think a lot of women don't even know what the options are.
That's correct.
Yes.
And it can change too. It can change in labor. You might have decided, oh, I absolutely want an epidural. I'm going in, I plan to get one, and then realize, you know what? I actually don't need one. Or I don't want an IV, but you go into labor, you've been laboring for 72 hours, you're exhausted, you're dehydrated. Actually, yeah, I think I would like an IV, because now I'm feeling like I'm exhausted, I'm uncomfortable, I can't concentrate. It's really that taking the responsibility on yourself, not the whole, oh, I'm doing it medicated or I'm doing it unmedicated. It's, what do you feel comfortable with as an individual autonomous person? Which decisions are you okay with? And then taking on that responsibility that it might cause something to go wrong or something to go right, or it might not cause anything at all. It's so hard in birth to know, because again, there's no guarantees.
So beautifully stated.
Yes. Yes. Alex, thank you so much for your time today. This has been fun. It's fun to watch the play and the chaos meant in the best possible way happening around you.
Oh yeah. And again, like today has just been it's a Monday, and I feel like Mondays are usually harder for us school wise. And then, like I said, we had birthdays over the weekend, so we had extra sugar that we don't normally have, and they got all these presents, and they're just like wild today. No, we don't need that yet. So I try to be more calm, but today I feel like very scatterbrained. So thank you for putting up with that all, and
of
my
course,
insanity.
Of course.
Well, you spoke beautifully and articulately, and you said so many important things. So
Thank you. Thank
you
you so
made
much
it
for having me too.
Yes.
I really appreciate it.
Yes.
And again, just your flexibility and your understanding. I know you're both moms too, so you get it. Yes, you want more
Yes.
snack. I know.
Yes.
You don't understand.
And for all of our listeners, we will include all of Alex's information that she wants to share with you in the show notes. You can definitely, I know she's on Instagram, you can follow her there and check up with the other wonderful things that she's doing. And if you are a doula and wanting to have additional training or feel like you need more support, she is definitely a great resource for that. So,
Thank you.
yes, so definitely do check her out. But anyways, thank you, Alex, and thank you, Caitlin. And yes, we will log off. Thank you for being here today. If you are loving this podcast, please go ahead and subscribe, and we would love if you would leave us a review. Sending so much love for you into this week, and we will see you soon.